Hello, my name is Claire, and I'm one of the counselors with SFA Counseling Services. My pronouns are she, her. I work with those students experiencing issues related to their mental health and students who are struggling with addiction. I recognize that counseling can be a bit awkward at times, and so I work to create an environment where you can feel safe to share. I am LGBTQ+ affirming and strive to nurture and support all students' authenticity and self-expression. I specialize in providing group therapy. I believe that it is through the group experience that students gain a greater sense of self-acceptance, community, and belonging. In the fall and spring semesters, I lead a support group for those students who identify as transgender and a women's group, where each week women from diverse, intersecting identities come together to share and offer one another support. All of our services are free and confidential, so give us a call or stop by our office to schedule an appointment, and let's talk.
Hello, my name is Ron Smith, and I am one of the mental health counselors here with SFA Counseling Services. I use the pronouns he, him, and his. I have a master's degree in community counseling that I received here at SFA in 2005. I enjoy meeting with and supporting students as they work to address a wide range of personal and mental health issues. In counseling, I view us as a team working together. You are in charge as we work together to use our unique expertise and perspectives to support you as you make changes and overcome obstacles. I specialize in working with students in areas like trauma, grief, and anger resolution, and I enjoy working with students who've been diagnosed on the autism spectrum. Like the other counselors here, I most frequently meet with students experiencing depression, anxiety, academic difficulties, relationship or family difficulties, or struggling with their sense of identity. I enjoy facilitating counseling groups for students and seeing how they can work together to support and validate each other and develop new skills and insights for meeting life's challenges. If you'd like to learn more, give us a call. Let's talk.
Hi, my name is Prisi Seha, and I'm a counselor here with Counseling Services. I enjoy working with students here on campus. I approach counseling through the lens that you, the student, is the expert in your life, and you have unique strengths and abilities to approach a variety of challenges or adjustments that you might be going through. I work alongside you to help identify additional techniques and skills that you can then apply towards your goals. I also approach counseling through the lens of trauma-informed care, meaning that I have an understanding that trauma can impact how we see the world as well as how we interact with the world. Therefore, it can impact how we cope with different challenges. I enjoy actively working towards becoming a more inclusive counselor through trainings and continuing education. Currently, I provide both individual as well as group counseling, and I facilitate a Latinx support group. If you'd like to learn more, give us a call. Let's talk.
Some of you might be familiar with the signs and symptoms of the more common mental health disorders that people struggle with. For many, though, it can be difficult to identify and understand how and why we feel the way we do. Most people do know someone who struggles with mental illness, and they want to help, but they just aren't sure how. I'm going to share with you some signs, symptoms, and behaviors that might indicate you or someone you know is struggling or even feeling suicidal. I am also going to give you some tips on how to stay safe or how to help a loved one stay safe when there are concerns of suicide. The following are symptoms of depression: feeling sad, irritable, or numb, feeling hopeless or worthless, changes in sleeping patterns, changes in eating patterns, difficulty concentrating or making decisions, feeling tired all the time, lack of interest in things that you typically enjoy, and finally, thoughts of suicide. Anxiousness presents itself as excessive worrying and sometimes severe and intrusive thoughts, making it hard to complete the tasks of the day. Some might avoid social situations, and it is common to feel agitated and restless. Anxiety can also lead to having tense muscles, intestinal issues, and unexplained body aches. For those who experience more severe anxiety, they might have panic attacks, where they find it is hard to breathe and they feel dizzy. For those who have experienced a traumatic event or have been victims of a complex trauma, such as ongoing abuse, food insecurity, family violence, discrimination, or oppression, symptoms may include feelings of shame or guilt, difficulty controlling one's emotions, difficulty in their relationships, physical symptoms like headaches, chest pain, and stomach aches. Many mental health issues, especially if experienced over a long period of time, can lead to destructive and risky behaviors, self-harm, and substance abuse. Everyone goes through tough times, and it is normal and actually even healthy to experience a wide range of emotions. Sometimes these emotions might feel uncomfortable, but they are important to pay attention to because they are telling us something. And experiencing that wide range of emotions makes us the unique humans that we are. It may be time to seek out professional help, though, when we find that we are experiencing these symptoms consistently, most of the day, most days of the week, for more than 2 weeks. It can be difficult to seek out help for ourselves when we are having thoughts of suicide. While having thoughts of suicide is actually more common than you think, it isn't really something that we talk about. The truth is, though, that if someone who is experiencing thoughts of suicide does get the appropriate treatment, it is effective between 60 and 80% of the time, and it is unlikely that they will experience those thoughts ever again. We understand that it can be difficult to ask someone if they are having thoughts of suicide. We recommend that if you are concerned about someone's safety, that you ask them directly. You give yourself plenty of time, listen, help them to feel safe and never judged, and finally encourage them to seek out professional care. Maybe even go with them that first time. If you don't feel like you can ask them directly if they're having thoughts of suicide, we recommend you find someone who can. If you or someone you know is having thoughts of suicide, go to your nearest emergency room, call UPD, or text hello to 741-741. You can also walk up to our office between the hours of 8 a.m. and 5 p.m. and visit our website for more information on resources in the Nacogdoches area. And remember, all of our services are free and confidential, so we encourage you to schedule an appointment. We are here to listen, and we are here to help.